In this lab lesson, we're going to go over the major basic set of instruments that we're going to be working with throughout this semester. There are different categories of instruments, so we'll go over the different categories and show you various instruments in those different categories. The first category we'll go to is cutting and dissecting. So we have a scalpel handle, and on this scalpel handle goes a scalpel blade. This is a number 3, and this is a number 7. The blades that go on here are the number 10, 15, 11, and 12. The next cutting and dissecting are scissors. Here we have a Jorgensen scissor. This is a curved Mayo. This is a straight Mayo. This is a 7-inch Metz, and this is a 5-inch Metz and Bomb scissor. Those are the instruments here that we have that are cutting and dissecting. Next we can go to the suturing needle holders, and we have a variety of needle holders here. We have small, medium, and large. The gold handle on these needle holders means that they have tungsten carbide in the tips of them. Not all of them have gold handles because we don't want you to just look at a gold handle and think that it's a needle holder. Next we'll look at clamping and occluding instruments. These are snaps. These are the workhorse of the operating room. Every case has a snap on it. These straight snaps, which are the same as the curved snaps, but they're straight. Then we have a curved mosquito snap, bigger than a mosquito. We have a straight mosquito, same as the curved mosquito. These are schnitz or tonsil snaps, and the tonsil snap or schnit, as you can see, is the exact same head as the curved snap, but longer. The next is a right angle, which is also a clamping and occluding, and the right angle is called so because it has an angle on the end and it goes to the right. Those are the clamping and occluding instruments that we have here. Now we'll go to the grasping and holding. The grasping and holding are usually forceps, but not necessarily forceps like this. This is a long toothed forcep. You can see that it has teeth on the end. This is a toothed Adson forcep. This is a small tooth forcep or a rat tooth forcep or pickups with teeth. This is a Bonney forcep or a Ferris-Smith forcep and also has teeth. And this is a neuro forceps with teeth. These all have teeth. This is a long smooth forcep. This is an atraumatic forcep. So you could pinch yourself with this and you won't hurt yourself. This is a DeBakey forcep, which is also atraumatic. And you can also pinch yourself with this. The DeBakey forceps has serrations at the tip, but they're not teeth. Those are forceps, grasping and holding. This is a straight coker. It's also grasping and holding. It has teeth on the end. That's not atraumatic. That might hurt you if you pinch yourself with that. This is a triple hook, which is also grasping and holding. But you can see the difference because these have the shanks, the box lock, and the ring handles, plus the ratchets, still grasping and holding. This is a Babcock. This is also a grasping and holding instrument. Again, it has the ring handles, the shanks, the box lock, but it's also atraumatic. You can pinch yourself with that and it does not hurt. This is an Alice. This is also a grasping and holding instrument, but it also has teeth at the end of it, but again with the ring handles. This is a sponge stick or Forester sponge stick or sponge forcep. It's also a grasping and holding. This is a towel clip. These are used on towels to keep towels in place. They're sharp, so they can't be used on paper, and you clip them onto the towels when you drape to keep the towels in place. Now we'll move to the retractors. These are the ribbon retractors or the malleable retractors. They come in large, medium, and small, and they call them malleable retractors because you can bend them. And then you can bend them back. These are the Richardson-Richards retractors. They're square. They come in different sizes. Sometimes they're called Kelly retractors. This is also a Richardson retractor, ladyfinger, appendiceal small hernia retractor. And you can see it's not square, it's longer, and it's narrower than the Richardson-Kelly retractors. They all have handles. Sometimes the handles are open, sometimes they're solid. This is a McBurney retractor. It's the smallest of the Richardson-like retractors. And you can see that it's much smaller than these Richardson right-angle retractors. This is the Army-Navy retractor or USA retractor. One side's a little longer than the other side, so it's a very versatile retractor used on almost every case. So if you need something that's a little deeper, you use the long side. A little shallower, you use the smaller side. The Army-Navy USA retractor. This is the pole retractor. The pole retractor also comes in different sizes and usually always has a solid handle like that. This is the vane retractor, also called the Cushing vane retractor. It's a small retractor used to expose small spaces. This is the rake retractor, and this is probably the easiest retractor to recognize because it looks like a rake. Or, as somebody just said, a back scratcher. Anyway. This is the Sen retractor. It has a rake on one end and a blunt right angle retractor on the other end. So it can be used like this or like this, usually on small cases. This is the Wheat-Lanner retractor. This is a self-retaining retractor. Self-retaining means it holds itself. You don't have to hold it. Now we'll go to the probing kind of instrumentation. This is the probe and the groove. The probe and the groove that comes in a set. So a probe would go into some kind of a tract of some kind of sinus tract, but first you might put the groove director in and then probe into it. Next are the suctioning instruments. This is a pool suction or a multi-hole suction. It comes in two pieces, so when it's sterilized it has to have the pieces apart. If you just need to suction a little bit of fluid, you use this part. If there's a lot of fluid, you put the multi-hole in it, and it's very good at sucking up that fluid. This is a Fraser suction. This is a smaller suction than the pool suction. It comes in different sizes. This is the number 7. This is a number 8 Fraser suction. It's for smaller cases or smaller spaces, and it also comes with a stylet. So if the Fraser suction gets plugged, you put the stylet in, and it helps unplug the Fraser suction. So these are the instruments in our major basic set, and these are the instruments that we're going to be working with for the rest of the semester. You have to know these instruments because these are the basic instruments in every single case. Clamping and occluding, grasping and holding, cutting and dissecting, suctioning, probing, and suturing instruments are all part of every set that you'll work with once you go to clinical. So these are the instruments that we'll be working with for the rest of the semester.